Namaskaram. I am Dr. Surej. Today we are going to discuss on a common topic known as osteoarthritis that affects the joints of millions of people across the globe. What is osteoarthritis? A joint is usually composed of bones, and these bones have a protective lining over each other that is known as cartilage, and this cartilage helps these bones to glide or move over the bones for a smoother function. And this cartilage also acts as a protective cushion, commonly which acts like a shock absorber, therefore facilitating a smoother and a pain-free movement. In the condition of osteoarthritis, this cartilage undergoes thinning due to the wear and tear, and ultimately resulting the bones to rub over each other. That leads to severe friction, leading to pain, swelling, and difficulty and restricted range of motion of these joints. This condition is called as osteoarthritis. Osteoarthritis usually affects the weight-bearing joints such as knee, hip, and the spine because they are all the weight-bearing joints. Apart from the weight-bearing joints, it may also affect the other joints. Though there are many factors that can lead to the formation of osteoarthritis, age, injury, obesity, and genetics play a major role in the formation of osteoarthritis. As the person ages, the ability for the body's tissues and the cells to regenerate a tissue also declines. This can also apply to the cartilage, thereby leading to the wear and tear of the cartilage, thus leading to osteoarthritis. Injury. For example, a person, if he has had a previous injury in his younger ages, that also leads to a severe or an accelerated form of the osteoarthritis when he or she develops it at a later stage. Obesity, so one of the risk factors for the osteoarthritis. A person being obese, of course, due to his weight, can start affecting the weight-bearing joints, like I said before, such as hips or knees, and that usually leads to the more wear and tear of the cartilage of these joints, thus leading to the formation of osteoarthritis in such cases. Apart from that, genetics also has a certain role in the formation of osteoarthritis because certain people in the population will be more predisposed to the formation of osteoarthritis. Certain genetic variations can also affect the structure and composition of the cartilage, making it more susceptible to the wear and tear, thus leading to the formation of osteoarthritis. Let us now understand how Ayurveda looks osteoarthritis as. According to Ayurveda, a balance of all the three doshas, Vata, Pitta, and Kapha, is said to be a person's most healthiest stage, or rather, a balance of all the three doshas is what causes the person to be more healthy. In osteoarthritis, it is usually said to be an imbalance of the Vata that leads to the condition of osteoarthritis, and it is commonly known as Sandhi Gada Vata, which means the Vata that is affecting the Sandhis. The Sandhis means the joints. In this condition, the quality of Vata also undergoes an imbalance, causing the increase in dryness that leads to the dryness of the joints or lessening up of the lubrication in the joints, and ultimately resulting in the degeneration of the tissues, including the cartilage. This imbalance of Vata can be caused due to many factors such as aging, exposure to cold weather and cold stuff, and also due to the different lifestyles that the person follows. Apart from the imbalance of Vata, Ayurveda also emphasizes the presence of Ama, a toxic byproduct of the improper digestion and metabolism. And Ama can also accumulate in these joints, thereby leading to the stiffness and swelling of the joints. So, while addressing a patient of Sandhigata Vata, it is of utmost importance that the Vata as well as Ama needs to be taken care when it comes into the treatment of Sandhigata Vata. Let's now see how Ayurveda can deal a condition of osteoarthritis or Sandhigata Vata. As we all know, Ayurveda always approaches in a holistic manner rather than just trying to specify the symptoms. So, Ayurveda always gives utmost importance to the causative factors such as the lifestyle and also the different diet patterns one is involved in. so that it can remove the root cause for the causative reason of osteoarthritis. For example, in the diet, the Ayurvedic physician might usually ask the patients during the consultation to understand his or her diet pattern and tries to identify the kind of food substances which are usually taken by the person that might cause the osteoarthritis. And the doctors usually advise the patients to avoid such things, and they might also include foods such as ginger or turmeric, etc., to be added into their food, and that can help fight the inflammation, etc. Apart from that, it is also very important that the patient maintains a proper and a healthy lifestyle. For example, obesity, which is one of the causes or the causative factors for osteoarthritis, is caused due to an improper or a sedentary lifestyle. And the doctors might advise patient to undergo or to do exercises which has low impact on the joints, such as walking, swimming, yoga, etc. Apart from this, herbal remedies and panchakarma treatments also plays a major or an important role while it comes to the treatment of osteoarthritis. Herbal remedies include prepared medications that has herbs such as gugulu, ashwagandha, etc., that can help fight the inflammation and also reduce the pain. And panchakarma treatments are usually advised in cases where there is a presence of ama, a condition of vata is extremely high. Now let's see what are the different type of external therapies that are advised in Ayurveda. Mainly, treatments such as abhyanga, where there is massage application of the warm oils on the affected joints in a day or a couple of days together or in weeks, is usually advised in case of Sandhigata Vata. Abhyanga helps to improve the circulation and nourish the joints, and also helps to reduce the stiffness of the joints, especially when it comes to the condition of severe degeneration. Apart from Abhyanga, treatments such as Lepa, Basti, Upanaha are also used while we treat the condition of osteoarthritis. Lepas are usually done when there is case of severe swelling, and Abhyanga cannot be performed in the condition of swelling, since the application of oil might increase the inflammation and the swelling. In such cases, the Lepas are usually administered. Basti or medicated enema are usually done in order to reduce the swelling and also to reduce the ama and vata in the body. And that is usually done when there is a severe increase of vata. Apart from that, Upanaha, a special kind of treatment where a herbal paste is applied onto the affected joints, and then later it is covered with plantain leaf and cloth, and it is given as a kind of sedation or artificial sweating on that affected joints, and that also helps to reduce this inflammation and the pain. Apart from these, treatments such as different kind of potlis like Churna Pinda Sweda or Patra Pinda Sweda are also performed depending upon the type of the patient and according to the doctor's logic. It is important to consult an Ayurvedic physician for a personalized, detailed treatment plan. Ayurveda can easily complement conventional medicines while it comes to the treatment of osteoarthritis. Remember, a holistic approach that combines diet, lifestyle, and Ayurvedic therapies can effectively treat osteoarthritis. I hope this video is helpful to you in understanding the Ayurvedic approaches of osteoarthritis. Thank you for watching. See you in the next video. Thank you.